So welcome everyone. My name is Dr. Samir Sinha, and I just want to welcome you to our webinar today. We just want to please note that all audience members' microphones are muted. If you do have a question for our speakers today, please use the Q&A box at the bottom of your screen. And if you have any technical issues, please let us know in the chat box at the bottom of your screen as well. So thank you again for joining us today. Just before we get started, we want to note that the NIA is based in Toronto, which is in the Dish with One Spoon territory. And the Dish with One Spoon is a treaty between the Anishinaabe, the Mississaugas, and the Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. So again, my name is Dr. Samir Sinha. I'm the Director of Health Policy Research at the National Institute on Aging, and I want to welcome all of you again to our webinar today called Vaccines for Older Canadians, What You Need to Know to Stay Healthy and Independent. And I want to just welcome on the screen right now my co-pilot, my colleague, Dr. Vivien Brown. You may be familiar with Vivien. She's been a regular speaker and commentator during our vaccination webinars. Vivien herself is a family physician and an author in Toronto. She is educated at McGill University, and she's currently appointed to the Department of Family and Community Medicine at the University of Toronto, holding the rank of assistant professor. She's an award winner for teaching on many levels. Her major interests are in the area of health promotion and prevention for women and continuing medical education, adult immunization, and vaccine-preventable illness. The College of Family Physicians of Ontario named Dr. Brown Physician of the Year for the region of Toronto, and that was awarded in November 2012. And she's also the past president of the Federation of Medical Women of Canada, and is the immediate past vice president for the North America for the Medical Women's International Association. Recently, she was named as one of Canada's most influential women by the organization Women of Influence for her work on advocacy on the HPV vaccine for Canadians. And in March 2017, she was honored to present HPV initiatives in Canada at UN meetings for the Commission on the Status of Women. In 2018, she was honored with the Media Award from the North American Menopause Society for her work in women's health, and she also received the May Cohen Award from the Federation of Medical Women of Canada for her work in women's health. In 2024, she received the Reproductive Health Award for her work in women's health and was awarded the King Charles III Coronation Medal for her work in the community. Most recently, in August 2025, the College of Family Physicians of Ontario awarded Dr. Brown a Certificate of Distinction for her level of devotion and patient care, and is noted as being an expert in vaccines and vaccine-preventable illness and adult immunization. She's the perfect co-pilot for today's webinar as well. So welcome, Dr. Brown, and good to have you here with us today.
Thank you so much.
Perfect. So the way we're going to structure this webinar is that we've got a few slides that we're going to present together. I'll take the lead, but Vivien is a colleague and friend. I'm going to invite her to kind of add her comments in and that. Then I might have one or two questions for Dr. Brown right after we do our presentations, but then we turn it over to you. So we want you to let us know what are the sorts of questions that are coming up for you when it comes to vaccines for older Canadians. So in terms of vaccine-preventable infectious diseases of concern for older adults, there are a number of vaccine-preventable infectious diseases that we want you to be aware of. We've heard about many of these, but in total, right now, COVID-19, influenza, also known as the flu, pneumococcal disease, known as pneumonia, respiratory syncytial virus, or RSV, shingles, tetanus, and diphtheria. These are all vaccine-preventable infectious diseases of concern for older adults. And that's why we want to talk about them today, because there are vaccines for all of these. And we want to make sure that everyone is aware of these opportunities and is able to take advantage of these opportunities, because many of these are publicly funded and available. When we think about some of the top 10 causes of death, the latest statistics we have are from 2023. And what you can see are these are the top 10 causes of death in Canada. And right now, COVID-19, influenza, and pneumonia, these are amongst our top 10 causes of death. And again, the key concern here is that these are largely vaccine preventable causes of death. In fact, in 2023, when we did the math, we found that more than 13,000 older Canadians lost their lives to COVID-19, influenza, and pneumonia. And as I said, many of these were vaccine preventable deaths. So it's helpful to know the numbers and why we're so keen on making sure that older Canadians know about these opportunities. When we think about COVID-19 and older Canadians, we know that older Canadians may present with COVID-19 symptoms differently or have less common symptoms as well. We talk about these as being atypical. So one of the common things you'll hear about during this webinar is that older people may not present in the same way that younger people with all the usual traditional symptoms. So it may be hard to appreciate whether once somebody is infected and therefore may have the consequences of these viruses as well. And we know that when we think about the outcomes of COVID-19, when we think about the impact, so many people are getting infected still every year, but we have to remember that for those who are 65 and older in Canada, 76% of Canada's close to 100,000 hospitalizations were amongst older Canadians. And 95% of our COVID-19 deaths in 2023 were again amongst older Canadians. So while people of all ages can certainly get infected, the real burden of disease when it comes to hospitalizations and deaths is amongst our older Canadians as well. And again, many of these outcomes are vaccine preventable. We also know that COVID-19 infections may also lead to post-COVID-19 condition, also known as long COVID. And some of you may have seen this. I know certainly I have colleagues, for example, but also older patients who've been affected by long COVID symptoms. And the greatest risk of getting long COVID is actually getting a COVID-19 infection in the first place. Vivien, from your experience, are you seeing this in your practice as well?
Unfortunately, Samir, I really am. And what people are feeling is excessive fatigue, muscle aches and pains, sometimes low-grade fevers coming and going. Some people have lost their sense of smell or sense of taste. But the pervasive symptom is excessive fatigue. Get up in the morning, take a shower, and you're too tired to even eat breakfast. So that level of fatigue is really a disability, and people are not able to function normally.
Yeah, and again, we think about, these issues, happening, say, in younger working age people, but for older people who want to just stay healthy and independent in the community, it's always helpful to remind ourselves that it's not just the infection itself, but it can actually be these long-term symptoms that can develop. And it's hard to predict who exactly will develop these
Yeah.
post-COVID-19 conditions or long COVID as well.
Yeah, no, you're looking at needing caregiving. I mean, it's a real change from independent living if you get long COVID.
Yeah, so that's why, again, it's helpful to think about some of the longer term consequences related to some of these vaccine preventable diseases. When we think about flu pneumonia and older Canadians, we know that, again, older Canadians have made up the majority of deaths, for example, related to influenza and pneumonia, but also pneumonia related inpatient hospitalizations as well. So again, these other illnesses also have their consequences, and again, largely vaccine preventable as well. When we think about RSV, for example, RSV is something that we didn't really talk about too much until a few years ago when vaccines became available finally to deal with this common respiratory infection. Often we focus a lot on RSV in young children because, again, at the extreme of ages, young children and older adults who have the weakest immune systems. And so we often hear about heavy burdens of hospitalization occurring amongst young children. So in this diagram that you see towards the left, you can see that dark blue area shows that about 70% of the hospitalizations in Canada have been related to younger people who are getting RSV, and only 22% of the hospitalizations were amongst people 65 and older. But at the same time, when we look at the impact of these hospitalizations related to the RSV virus, we know that 1 in 9 of those older adults who've been hospitalized have ended up dying, and they represent 85% of the overall deaths. Whereas the good news is only 1 in 1,000 of the people under 5 who've been hospitalized have actually died. So again, it really reminds us that, while older adults represent a small proportion of those being hospitalized due to RSV in Canada every year, we certainly see the burden, the negative burden of death, for example, is more significant amongst older people as well. And when we want to compare RSV, because it's something relatively new within, kind of the public's thinking, we've known as clinicians, we've known about RSV for years. The problem is that we never really tested for it because we didn't really have any meaningful treatments for it, for example. But now we actually have vaccines that can prevent RSV. But in terms of understanding the burden of RSV versus influenza, something that we're more likely to get our annual flu shot against, for example, we can see that the blue bars represent RSV related outcomes versus influenza, and you can see that right now the outcomes are pretty comparable in terms of deaths, in terms of hospital readmissions, cardiac complications, lower respiratory complications, and bacterial superinfections as well. So again, think about influenza and RSV being similarly burdensome, certainly not as burdensome of COVID-19, but again, all these things are vaccine preventable. And one of the things, again, that we want to talk about is we talked about long COVID or post-COVID condition, but we know that for many people who get hospitalized, whether it be for RSV, for COVID-19, for influenza or pneumonia, we know that when we look at a loss of function, we know that 1 in 3 patients who are discharged after a hospitalization were discharged with a lower than their baseline functional status. And the challenge is that 8% fewer patients were able to live independently in the end, meaning that they were now dependent on caregivers, or they might have needed to go into a long-term care setting, for example. And Vivien, again, in your practice as a family doctor, I know certainly, I'm in the hospital right now seeing lots of patients and admitting people with influenza, for example. I'm always worried about that end point. How is this going to end? Will they make it out of hospital? And if they do, they may very well make it out of hospital with less than their baseline functioning. But from your perspective as a family doctor, are you seeing this as well?
I absolutely am. And what I'm telling people as we're talking about vaccine is if you do get admitted to hospital and you do survive the illness, RSV, pneumonia, whatever it is we're talking about, it doesn't mean that you're going home the same. You are never the same. You may be impaired in your breathing. You may not have that level of independence that you did before. You may be much more frail. You may need much more caregiving. And this study was done 6 months after hospitalization. So people had time to recover, but they don't recover back to their baseline. They recover, but they're at a lower functional status.
Yeah. So again, just reminding us kind of why we want to just try and avoid getting these infections whenever possible in the first place, or lowering the burden of infection through vaccination as well. So speaking of other ones, shingles infections are also an unnecessary burden on older adults. Shingles is actually caused by a reactivation of the virus responsible for chickenpox infections, and it happens more commonly during periods of stress and in older adults who have weaker immune systems as we age. So the majority of us, who haven't been of the age where there was a varicella vaccine, have likely experienced a chickenpox infection. And so we all end up being a bit of sitting ducks, for example, for the risk of getting shingles later in life. And we know older Canadians in particular experience higher rates of shingles infections, but also complications like prolonged severe pain, also known as post-herpetic neuralgia, but also hospitalizations and deaths as well.
And Samir, women are more at risk than men. Age is a risk factor. So the older you are, the more likely you are to get an infection from shingles. By the time you're about 80, the numbers in Canada are about 1 in 2. About 50% of Canadians will experience shingles once you're into your 80s. So this is an absolute must to get this vaccine and prevent this disease, because that chronic pain can be months to years after an infection.
Yeah, and certainly I've had a few, it's not so much, I think as clinicians, we're not so worried about that initial rash, that looks ugly but lasts for about a week. It's more the idea that we know that too many patients end up developing that complication where it's that severe burning pain that can last for weeks, months, even years, and really can be severely disabling as well.
Absolutely.
So when we think about this, we also have to remember that acute infections may also cause less well-known complications. So you've already heard a little bit about this in some of the previous slides, but we have to remember that things like herpes zosters or shingles, as we're calling it, influenza and RSV, these can also lead to an increased risk of stroke, heart attacks, for example, pneumonia, but also congestive heart failure as well. And I think it's important to think about these infections. When you get infected, you're in a more what we call a pro-inflammatory state. So things are more inflamed within your body, which can then increase that risk of stroke, increase that demand on your heart that can lead to a heart attack, for example. But then we can get those superimposed infections that can lead to pneumonia or challenges with our heart as well. So again, it's just remembering that there are also these less well-known complications, and sometimes someone enters hospital and then they die of a heart attack or a stroke, but people forget that what actually triggered this was actually one of these vaccine preventable infections. So the other thing is that we often don't really talk about this. We think about this as something that we get as kids, but tetanus and diphtheria infections are things that continue to impact us at all ages. And again, they can lead to serious outcomes as well. And we know that unvaccinated older adults have one of the highest death rates against this. So again, this is why we recommend that people stay up to date throughout their lives with their vaccinations against tetanus and diphtheria as well. So again, so why are older adults at greater risk for respiratory and other infectious diseases? I've alluded to a little of this, but again, as we get older, our immune systems are not as strong. They start having what we call age-related declines in our overall immunity. So our ability to mount an effective immune response is not as robust as when we're a younger adult, if you will. So children often, young children are in the process of developing their immune systems, and then for most of our lives as adults, we have a pretty good, robust system. But then as we age, it starts to kind of experience a bit of mileage. It's just not as robust and strong. And so then that makes us more susceptible. We also know that as we get older, our lung tissues, for example, when we think about respiratory infections, that actually tends to age as well. It's not as elastic, it's not as robust. So it doesn't allow us to fight off infections as easily as we would have at an earlier state. And if you're living with a number of chronic conditions, for example, if you have underlying coronary artery disease, that puts you at increased risk for having some of these cardiac complications that we sometimes see as well. So again, thinking about these chronic conditions, which can also affect our general immunity, it creates a bit of a vicious cycle overall as well. And when we think about this, this diagram just reminds us that again, that there are a number of factors that really show how our risks of infectious disease is at its highest at points 1 and 3 at those extremes of age, and we have the best immune response kind of at number 2, kind of in that middle there. So again, this is just a way of picturing kind of what I just spoke about, why we see kind of those immune system changes over an individual's life, and why we emphasize vaccination for young children, but also for older adults as well. And so it's also important to remember that, again, as I've been talking about, that vaccine preventable infectious diseases have been associated with many medical conditions, including heart conditions, respiratory conditions, cognitive impairment, and diabetes, meaning that if you have one of these underlying chronic health issues, for example, it can actually increase your risk of getting one of these vaccine preventable diseases, but also suffering more of the consequences from that. But Vivien, we were talking before this about just even how these vaccine preventable diseases can also sometimes increase the risks of these conditions as well. And you had an interesting point about cognitive impairment.
Yeah, there's some research, Samir, that suggests that if you're admitted to the hospital with pneumonia, that you have a significant increased risk of cognitive impairment. And you can imagine that you're not getting good airflow, you're not getting good blood flow. And so if you were managing well in your own community, in your own apartment, whatever, in a strange location with all of the stimuli that go on in hospital, what we're seeing actually is an increased risk of cognitive impairment. And the reverse of that is interesting because there's some research looking at shingles vaccine and the fact that if you take shingles vaccine, there's a trend to reducing your risk of cognitive impairment. So if we can keep you healthy, we're less likely to impair brain function. That's the bottom line. We want to keep you healthy so that your brain can work properly.
Yeah, and maybe part of that theory is that inflammatory state that we have when we get an infection on board, which can again trigger things like strokes or other vascular issues, which can lead to more vascular cognitive impairments or that risk of delirium. So again, it's these things are all connected, and why it's really important to kind of think about those connections. And this is also another slide that I know we both like, because it reminds us that certain infectious diseases increase that risk of developing one of those comorbidities, so one of those problems that can happen, such as, that chronic inflammation, that cardiac disease, these other things, but then having those underlying cognitive impairments make us more susceptible. So it becomes almost a bit of a vicious cycle. And so hence why, if people have underlying chronic conditions, we really recommend that they consider getting vaccinated. And if people do get a chronic infection, it's helpful to understand how that can actually lead to more comorbidities and problems as well.
Yeah, exactly right.
And again, when we think about reinfection as well, it's actually common with certain viruses. So the classic case is things like RSV, for example. So we know that that when people get an RSV infection, there's some types of infections, for example, where we actually develop a good lifelong immunity. But there are other things, many infections, for example, where we'll develop short-lived immunity or incomplete immunity, and then that can allow us to have recurrent infections throughout the life course. And that's why we recommend, for example, that people do get vaccinated. So because RSV is one of those viruses where if we experience it, we might have incomplete and short-lived immunity. That's why getting a vaccine means that you get the right dose, the right information, so that your body can prepare, a good, robust immune response that can last at least for a few years. But this is also why we, for example, need to continually get updated for our influenza vaccinations every year, because the strains change, and that's important, for example. And same thing with COVID-19. So it's important to remember that certain viruses can lead to reinfection, for example, because especially if we haven't gotten vaccinated against those as well. And so the other thing too is that sometimes, as clinicians, we have a person who comes in with some respiratory symptoms, for example, and it's really hard for us to actually distinguish between, is this RSV, is this influenza, is this COVID-19, or is this kind of the common cold, for example, because there are a number of other viruses that circulate during cold and flu season. And as you can see from this chart on the right, there are many common symptoms that are hard for us to distinguish, and therefore know exactly how to treat. So right now, for example, when someone comes in with respiratory symptoms to Sinai or the University Health Network hospitals here in Toronto, we just actually give them a swab that looks for all of these things: RSV, influenza A, influenza B, COVID-19, because we're not really sure what we're dealing with. But if we can figure out what we're dealing with, for example, then we may be able to give some further treatments. But again, the best thing to do in the first place is just to get vaccinated, so you don't have to play this game of, what do I have? Is this going to be a concern or not? Because it's a bit of a guessing game, to be honest.
And Samir, it doesn't matter how good a clinician you are, statistically, you can't tell the difference. And in community practices, we don't give swabs. We have no way of telling which infection is which. We really only send the sickest to the hospital where they can get swabs and they can get that analysis. And for influenza, we sometimes use Tamiflu, and for COVID-19, we sometimes use Paxlovid. But for RSV, we have nothing to offer. So even if we know it's RSV, it's only supportive care. we're giving IV fluid, we're giving oxygen, but it's not like we have a great drug to offer you. And these viruses are all coming together at the same time of year. And so it's very easy if you have one to be more susceptible to another one. You may have two at a time. They're not distinct enough.
Absolutely. And so, and just this is a really good illustration, Vivien, to just your point here. Let's take a look at kind of our previous and seasons, for example, what we call respiratory virus season. What you can see, for example, with the darker lines here, the black line shows kind of the 2024-2025 COVID-19 season. You can actually see that COVID-19 is still one of those viruses that doesn't necessarily follow that traditional respiratory season kind of path, the way that we think of with RSV and influenza. We usually talk about cold and flu season as being between kind of November and May, if you will, and that's why we really start our vaccination campaigns kind of late September, but mostly October, to kind of get people ready for those. But as you can see, it's hard to always predict when COVID-19 season will kick off, when RSV season will kick off, and even in particular last year, what we saw, our influenza season really didn't take off until till later, kind of in the fall, for example. So you can see by December and then well through January, February, March, we had a huge influenza peak last year. Vivien, I know we were talking before this about how we've been seeing reports from our colleagues in the Southern Hemisphere that just had the most recent kind of had their winter and their respiratory season. And they've certainly been reporting, quite significant influenza seasons this past year as well. That's what you've heard as well.
Yeah, we heard that from Australia and we've heard it from Japan. And so that's a predictor that we're likely to have a difficult season as well, which is all the more reason to get immunized. If we can see it coming because they've already had their season, then we want to be prepared for this.
Absolutely. So again, why are vaccines important to enable healthy aging? Because again, our immunity weakens as we age. We know that vaccination therefore helps prepare our bodies to fight vaccine-preventable infections. And vaccinations also help us protect others, because if I don't actually get infected, for example, then I'm less likely to actually infect somebody else as well. We also know that vaccines have eliminated certain deadly diseases, but for example, we just lost our measles status, from the World Health Organization. So again, we have an opportunity to eliminate certain deadly diseases, but we have to really be on top of this by making sure that enough people are getting vaccinated. And our acquired protection itself can weaken over time. And that's why, for example, we recommend that every older person is getting, the COVID-19 vaccine at least once a year, and certain people at least twice a year, because we know that if your immune system isn't as strong as others, for example, you may need more frequent vaccination as well. And we know that overall, the data is very clear that vaccines are a very safe option to help protect our health and well-being as well. And so the key is that there's been some updated vaccines and new recommendations in Canada over the past year. And so we want to share a little bit more about that right now, because what we know is that for COVID-19, the recommendation for older Canadians from our National Advisory Committee on Immunization is that everybody get at least one dose per year, and certainly for particularly older adults, for example, we recommend even twice a year. And this is all available free through various providers in your provinces or territories. With the influenza vaccine, again, we recommend that everybody get one dose per year. That's for everybody 6 months of age and older. And for older people in particular, we recommend that they get one of the enhanced vaccines like Fluad or the Fluzone high dose vaccine, which again are generally available through a variety of providers as well. I mentioned RSV vaccines because I want to spend a moment or two here because these are relatively new vaccines that have been approved and have come on the market. And NACI right now recommends that adults 75 and older, especially those with certain chronic conditions, are getting vaccinated, and adults 68 years and older in chronic care settings. This is what the official recommendations. But this also might be considered for adults 50 to 74 in consultation with your healthcare provider. And again, coverage now exists within 9 provinces and territories. So this is something that's been rapidly advancing over the past year. And certainly for people 50 to 74, this is a helpful slide. Vivien, I think you gave this to me from the CDC that really helps to kind of explain if you're a younger, older adult, these are some of the conditions or folks that may want to consider getting an RSV vaccine. But Vivien, did you have anything else to say about this?
I just wanted to say that recently Health Canada has approved the RSV vaccine Abrysvo for adults 18 to 59 who are immunosuppressed or very high risk. So if you're one of those people that's a little bit younger and you haven't considered this vaccine, but you have one of these immunomodulating diseases such as lupus or psoriasis or colitis, or you're on one of the drugs that suppresses your immune system, you may want to talk to your healthcare provider about getting an RSV vaccine, even though you're under age 60.
And so again, when it's RSV, again, there's 3 that are approved by Health Canada: Abrysvo, Arexvy, and Mrezivia. And again, there's varying coverage. Again, we mentioned that 9 provinces are now covering this in various ways. So again, check there, and we actually have some resources that can help you understand what's covered and where you might be able to get it. And we'll talk about that in a second. Again, against pneumococcal or pneumonia, pneumococcal disease, the recommendation is now to get at least 1 dose over your lifetime of Prevnar 20 or Capvaxive. And again, you'll be able to get that for free, at least the pneumococcal vaccine. And you just need it once, over the age of 65 as well. In that way. And the RSV vaccine right now has been seen to be good for at least 3 or more seasons. So again, this is such a relatively new vaccine. We continue to wait to see how long it might give us good protection for.
And Samir, people often ask about the RSV vaccine, when do I get a booster? If they've had it when it first came out in 2023. And the answer is both in the US and Canada, there's no recommendations for boosters at this time. So even if you are eligible in Ontario now over age 75 to get the vaccine, if you've already had it, you don't get it a second time. Now that may evolve and we may have more information in the next year or two, but right now there's no advice for booster doses.
Absolutely. And so again, when we think about the other vaccines that we've been mentioning, shingles, again, this is a 2-dose vaccine known as Shingrix. And again, there's varying coverage across provinces and territories, but again, we have some resources that can give you more details on what might be covered in your province and where you can get it through. And again, tetanus and diphtheria, we don't think about it often, but we still recommend that throughout your life, 1 dose every 10 years. You may get it a bit more frequently if you've had a cut or a situation that might require a tetanus booster. But again, these are available free as well. But the key is that one of the reasons why we're doing this webinar is that while there's really good evidence and good reasons for why older Canadians should get vaccinated against these vaccine-preventable diseases, we're still really not hitting our goals. The Public Health Agency of Canada has long held a goal that they want at least 80% of older Canadians vaccinated against with the pneumococcal vaccine. Again, you only need it once, over the age of 65, yet only, about 55% or so of older Canadians have gotten this vaccine. We know when it comes to things like the annual influenza vaccine, we're in the 70 percentile range, but we've never really hit the 80 percentile range. And shingles right now, we still have less than 40% of people have actually gotten that vaccine. So again, a lot of missed opportunities here, and why we still see that close to 13,000 people, in 2023 died, from COVID-19, influenza, and pneumonia as well. And again, people often think that they're actually fully up to date with their vaccines because we know as of June 2024, 95% of our older Canadians had received at least one dose of the COVID-19 vaccine. So we know that it's not that older adults are vaccine hesitant. It's just kind of staying up to date and making sure that people have access to these vaccines is really key because right now only 10% of older Canadians have been up to date with their COVID-19 recommended vaccines. So I still see a lot of my patients who are like, I've had 7 or 8 vaccines now. Do I need any more? And I'm like, you need to have it at least once a year. And if you're certain types of older adults, need to have it at least twice a year, for example. So again, we want to make sure that people know what are the recommendations so they can really stay up to date and have the maximal protection that's needed as well. The other key thing is that sometimes people say, oh, I wasn't sure if I could get more than one vaccine at the same time. And the good news is that vaccines may be safely given at the same time together. And so ask your health care provider what vaccines you're eligible for and which could be safely co-administered to make it more convenient for you to stay up to date with your recommended vaccines. And finally, when we think about immunization, we think about it as being a team approach. And Vivien, I know this is one of the things that you often promote when you talk about vaccinations. And do you want to explain a little bit of this concept a bit more, why we talk about this being a team approach?
But I think the bottom line is the patient is the center of the story, and there's no wrong door for vaccines. If you get it at the pharmacy, if you get it at public health, if you get it through a work situation, if you get it at the hospital because you're a volunteer there, it really doesn't matter where you get the vaccine. It matters that you're vaccinated. Now, we don't have a great tracking system in Canada. Each province does things differently, and particularly in Ontario, we're just starting to talk about a tracking system. So I would encourage you to keep track of what vaccination you've had and discuss it with your primary care provider so that we can keep our files up to date, because public health in Ontario only follows you until you're 18 years old. But the bottom line is we're now talking to dentists about talking about immunization when we're thinking about oral HPV. And so in general, anybody involved in the healthcare system, which includes the school system, it includes nurses, private insurance, employee benefits, we're all on the same team. We're all there for the patient, and we all want everyone to get immunized.
Perfect. And so again, I mentioned that we have some resources here because again, there's a lot of information. Some of you may have been taking notes, but the good news is on the NIA website now, we have available a guide to vaccines for older Canadians. This has been updated. So this is everything you need to know for the 25-26 season. And this is soon will be available in French and at least 10 other languages as well. So this is your comprehensive guide, gives you all the information you need to know. We also have an in-depth pamphlet that really speaks to COVID-19 vaccines. Again, what older Canadians need to know, because sometimes there's still some lingering questions. We want to make sure that you get all of those answered as well. And then what's really cool is this year, really proud that my colleague, Arushan Arulnambi, one of our health policy analysts, has created these really wonderful provincial and territorial vaccine one-pagers. So for each province and territory, and this will soon be available in multiple languages as well, it tells you exactly what is covered, what is recommended, and what is covered so that you can basically almost print this out literally, take it to Dr. Brown and say, Dr. Brown, am I up to date on these things? What don't, it's almost like a little bit of a checklist that you can actually use to make sure that you are up to date with what you are eligible for. So again, those are available like by province and territory, and it gives you all the details around coverage, what you need to know. So we hope that you find that useful as well. And I know my colleague is putting that in the link in the chats right now. But I'm just trying to organize myself here. 1 second. I'm going to make sure that we can stop sharing, and That way we can have a conversation. Perfect. We're ready to start taking your questions. So if you have any questions, please put them in the Q&A. But Dr. Brown, before we quickly go to questions, any other things that you want to mention or anything you want to focus on as well that we may not have covered in our presentation?
I think, Samir, that what I would encourage everybody to do is to normalize this discussion. If you're going into your doctor for blood pressure, if you're going in because you've got drugs for cholesterol, doesn't matter what the appointment is for, double check your immunization record. Because what we've seen is if you get one of these diseases, it increases your cardiac risk, it increases your cerebrovascular risk, the risk of stroke, increases your risk of pneumonia if you get influenza. The bottom line is every visit should be a visit to double check your immunization. And that's what I mean by normalizing the conversation. Most patients don't book an appointment just to talk about immunization. They're usually coming in for something else. And it's that something else that gets a lot of attention. But you're there, the doctor's got the computer open. Let's look at your immunization status and make sure you're up to date.
Perfect. Excellent. So we've got a number of good questions. And again, I think the nice news is that as the questions have been coming in, people have asked, like, do you have a list of the recommended vaccines? And these different ones. But so I'm glad that we've been answering them. But there's some questions here, for example, Vivien, for example, one attendee asks, some of my friends' family doctors are not telling people 65 and older to get the COVID-19 shot. Why is that? Conversely, I've also heard that family doctors get paid to give the COVID-19 vaccines by big pharma, so they have a vested interest in promoting them. Is that a myth? So, yeah, a few things here that I think you can set the record straight here.
So first of all, every doctor in Ontario, for the most part, gets paid by OHIP. And you get paid for administering a vaccine, whether it's tetanus or whether it's measles or whatever vaccine it is. Big Pharma does not pay you anything. And most COVID shots are not being done by doctors because there's a lot of paperwork involved. Most COVID shots are being done in pharmacies or hospitals. So I would suggest that you speak to your pharmacist about getting a COVID vaccine. And I don't know why other family doctors are not encouraging people to get their COVID vaccine because, as Samir showed us, COVID is still out there. It's a killer disease and it's killing people over the age of 65. So I do think you need a COVID shot this fall because there's new serotypes and the vaccine is more specific. I took my COVID vaccine about a month ago. I got it done at the pharmacy in Loblaws.
Perfect. I'm glad that we've been answering most people's questions here, but here's a question, because sometimes, there are vaccines that are covered and others that aren't covered, for example. So one of our attendees says, can you comment on the recommendation around the pneumococcal vaccine? Because you can certainly get the Prevnar vaccine, Prevnar 20 free, but the capsaicin, for example, pneumonia vaccine that's also available may not be covered. So, they were just asking, could we comment on the recommendation? What are your thoughts?
So just to be clear, it's different in every province, but in Ontario, Ontario will pay for PCV 20 or Prevnar 20 for anybody over the age of 65 who has not already had a vaccine paid for by public health. So if you took Pneumovax when you were a little bit younger, then technically you're not eligible to get PCV 20 without paying for it yourself. PCV 21, which is Capvaxive, is a new vaccine that's really focused on adults. And what they've done is they've dropped a number of the serotypes that were common for children, and they've added extra serotypes that are more common in adults. Our current national guidelines says get either PCV 20, which is Prevnar 20, or PCV 21, which is Capvaxive. So national guidelines say either vaccine, but a lot of the infectious disease specialists and people that are dealing with patients who are immunocompromised suggest that it may be worth it for you to get both. If you do choose to get both, that's a discussion you should have with your primary healthcare provider, and you would not be covered by the government for the second pneumonia vaccine. That's something you would have to pay for yourself. But I often phrase this that there is a cost for vaccines, but there also is a cost for not being vaccinated. And the cost for not being vaccinated is taking that Russian roulette chance of getting one of these serious, serious diseases. So I would package this as how much do you value preventative care and what is best for you? Not everybody needs both vaccines, and the guidelines suggest one or the other, But if you are particularly high risk, a kidney transplant patient, someone without a spleen, someone on multiple immunosuppressive drugs, you may want to talk to your healthcare provider about getting both pneumonia vaccines.
That's excellent. Yeah. And I think that it's certainly there's been some questions, for example, I'll just quickly kind of motor through some of these, Vivien, and you can also kind of give your folks as well. But some people are saying that my doctor's office doesn't have some of these vaccines, and that's why I think we're recommending that if you're, with our one pagers, for example, it reminds you what is actually covered in your province, and certainly there are a number of doctors' offices that will have these vaccines available, but some doctors are just saying, you know what, you can easily get it through the local pharmacy as well. So again, keep your sheet there. It reminds you where you can get these vaccines. But again, not everybody is offering vaccines, and I think it's a bit annoying to me. I think everybody should be having them and everybody should be administering them. But if your doctor's office doesn't have it, certainly they should be able to tell you where you can actually get that vaccine as well.
And if you have any kind of insurance coverage, ask your doctor for a prescription, because the pharmacist can administer the vaccines, but you still may be able to get it covered if you have a prescription for that particular vaccine.
Exactly. And again, you can always talk to your pharmacist about, if they say, oh, we have a vaccine here and you have to pay for it, but they'll tell you that if I get a prescription for it, for example, or if I have private drug coverage, for example, like these are the sorts of things. But again, with our one pagers, we're hoping to kind of demystify a lot of that. So you can make sure you know what's recommended, what's covered in your province as well. We've got some people are asking about when should I get boosters, for example. One person, for example, is asking about how often should I get the shingle shot, for example, and if I got it when I was 65, for example, will they say, will it protect me for the next 20 years, or does one need to seek out a booster, and when, for example? And I think I know right now we have data saying that the current Shingrix vaccine has been seen to be effective for at least 11 seasons now, if not more. But Vivien?
Yeah, so GSK created the Shingrix vaccine, and they did some really excellent research. And they've got modeling numbers going past 20 years. So the vaccine's been out for about 11 years. We know that absolutely you get good protection, but their expectation is more than 20 years of protection. So there's no recommendation to get a booster for Shingrix. There's no recommendation at this particular time to get a booster for RSV. The pneumonia vaccines are long lasting. We never say forever in medicine. We get new information and we sometimes need to update that information, but the pneumonia vaccines are long lasting as well. The vaccine that you need to get every year is influenza, and that's because the vaccine composition changes based on the predictability of what types of influenza are actually circulating. So yes, every year for influenza, yes, every year for COVID. The other vaccines are long lasting.
Yeah. There's another question that's coming up about what about the current flu COVID vaccines? Are they a good match for this year's strains? And I think, certainly there was some news the other day that we're seeing more of an issue with some of the influenza strains. They may not be as great a match this year as it has been in previous years. But what are you saying about the current strains that are circulating, and how do we address that?
So what we're thinking is that this year is not an ideal match because of the strains that are circulating. So maybe instead of getting a certain percentage, let's just say average 60% efficacy, maybe we're only going to get 50% efficacy or 45% efficacy. But what does that mean clinically? It means clinically you may still get the flu, but you're not likely to end up in hospital with influenza. And I think our expectation of adult vaccines needs to be very clear. We attenuate the disease, which means we decrease its severity. We don't necessarily eliminate the disease. So you may still get influenza, but you're not likely to get hospitalized. You may still get a mild case of COVID, but you're not likely to need a ventilator. When we get immunized, our immune system is primed, it's ready, our soldiers are on guard. Now, we may not have the exact right soldiers, but whatever we have is better than not having any. And so the immunizations, I think, are very effective in decreasing risk, not eliminating risk. And that's a big difference.
Thanks. The other questions that we're getting, for example, one question is saying, this person saying, okay, so I'm 65 years old, and is it okay for me not to get the regular flu vaccine versus, say, the high dose or the enhanced the adjuvant vaccine? And the reason they say this is they said, I'm petite and get a very sore arm post vaccine, so I'm concerned the higher dose will be harder to tolerate.
Yeah.
So again, I would just say, look, any vaccine, even the regular influenza vaccine is better than no influenza vaccine. But we know that the enhanced forms of vaccines are even better for older people. But I rather someone take something rather than nothing. But
Yeah.
Vivien, what would your advice be?
Well, I would also add to that that the vaccines are not based on weight. And realistically, a 65-year-old is only 1 year older than 64 when you took the regular vaccine. The enhanced vaccines are really designed for people's aging immune system. And so at 65, your system is not that much older than it was a year ago. However, we do know that as you age, your immune system gets weaker, your eyesight gets weaker. That's why you start to wear glasses. So I do think the enhanced vaccines are worth it. Whether you take it at 65 or not is really a minor consideration. Everybody gets a sore arm, or most people get a sore arm, and that's based on your muscle mass. And it's also based on the inflammatory response. And what I'm telling my patients is when you do get a large local reaction, your arm is really sore, you know you had that vaccine, that's your antibodies. They're up and running. You've had a good response to the vaccine.
Absolutely. Someone was saying, can one be asymptomatic, with COVID-19 or flu or RSV and pass it on? We're both nodding our heads.
Yeah,
Absolutely.
for
And
sure.
as older people, sometimes we'll have more atypical presentations. You may not have the full-on symptoms, or you have a very, very mild infection. So you certainly can pass it on. But again, getting vaccinated reduces the risk that you'll get it, and can reduce the risk of a more severe infection that is more easily passed on to other people.
And it reduces the risk that you'll spread it because you could have a day or two of fatigue and that may have been an infection that you didn't get that sick with, but then you're carrying that virus and you're around other people and you may be spreading it to them.
Yeah. There's another question saying, there's a few questions that have come in. One is looking at kind of the preservatives in vaccines and people asking, for example, about, the preservative BAK and magnesium stearate. And then also there's a question around why do some of the flu vaccines contain thimerosal? And they said, isn't that mercury? Is that safe? So a few things about like what do vaccines contain and are they safe?
Well, they contain preservatives so that the vaccines themselves don't get contaminated. And when there was an effort in the US, I believe it was in the state of Maryland, people started using a medication without preservatives, and they ended up seeing fungal meningitis in people that had had injections in their back of corticosteroids for back pain. The reality is these minor amounts of preservatives are to keep the vaccine clean so that whatever we're giving you will not cause a disease in you. Health Canada has reviewed this very clearly, whether it's thimerosal, whether it's one of the other preservatives. These are minute amounts and felt to be extremely safe. It's not safe to take a vaccine that does not have preservatives.
Yeah. And I think someone was saying I'm just worried, I've had, previous, bad reaction to the flu vaccine in the past. And so again, if you're worried about, being allergic or a bad reaction, good to talk to your healthcare provider about what your concerns are. Because again, there may be alternatives, there may be other things that you consider, as opposed to this person says, I just stay home and then just wear a mask and just really try and avoid others. And we don't want that. You don't necessarily need to do that if you have the right protection on board. So there are options available, and so we want people to know about that as well.
And Samir, I've occasionally sent a patient to an allergist to be assessed
Yeah.
as to whether she was safe for the vaccine and had the vaccine administered in the allergist office. So, if it's an unusual case, speak to your doctor, get the referral, do things safely. But for most of us, going to the pharmacy is perfectly fine.
Yeah. And then someone was saying here, Anne is asking, if you had two vaccinations at one time and end up with side effects, how would you know which vaccine caused them? It's a good question, right? But usually the most vaccines tend to have similar side effects. I know when I got my COVID and my flu, at the same time, I had two sore arms, and I was a little bit fatigued. But either way, these are the most common side effects are the same for most vaccines. It's kind of sore arm, maybe a little bit sniffly, but again, I always like that as a sign that I have an immune system. It's working in that way. But you're right. If you take two at the same time, you may not know which one was causing which. You'll know which arm is sore, and that can give you some indication. But if you are worried about side effects and wanting to monitor, you can always pace them out. But again, we want to remind most people that it's perfectly safe to get many of them at the same time.
If anything, Moderna is doing research, and Moderna is looking at a COVID vaccine and a flu vaccine in one shot. So that maybe next year or the year after, you'll go to the pharmacy and you'll just get one shot and be done for both diseases.
Yeah. And then someone was saying, can you repeat what's the extra strength vaccine? Again, this is for influenza. Again, there is a vaccine specifically designed for older adults. And again, the two brands available are Fluad, or there's the Fluzone high dose, for example. These are what we call enhanced flu vaccines that are available. But again, if for some reason they're not available, then you can still get the regular one. But we recommend people try and get the one designed as well. And someone asked a good question actually, because with the new PCV20 vaccine or the PCV21, so this is the Prevnar 20 or the Capsaicin. People are saying, if I got Prevnar 13 and the PPV23, the older versions of pneumonia vaccines, do I need the updated PCV20 or PCV21? And the answer is yes. But Vivien, do you want to say anything more?
So what you got when you got PCV13 and Pneumovax, which is PPSV23, is you did get a broad range of serotypes, but the Pneumovax was a polysaccharide vaccine, which means it doesn't last long. It lasted about 3 to 5 years. So if you look at PCV13, PCV20 has 7 more serotypes, which are common in adults. And PCV21, which is Capvaxive, has another 8 serotypes on top of that, having dropped some of the childhood serotypes. So you absolutely need one of those two vaccines in order to cover the serotypes that we see more commonly in older adults.
Perfect. And you know what? It is 12:58, and we have answered 25 questions, Vivien. And there's at least 20 more. People just keep peppering them in as well. So, but thank you. I just want to say thank you, first of all, Vivien, for being my co-pilot again. This is becoming an annual tradition, but you are a wealth of knowledge. And again, as a frontline family physician who's very passionate about vaccination, again, it's really helpful to really dispel myths and make sure that people know what they need to know about vaccinations. There'll be a copy of this webinar, so if you want to rewatch it, again, we've also when we send out, I believe, the copy of the webinar, we'll make sure again you have the links to all of our new vaccine resources that again answer a lot of the questions that we weren't able to get towards as well. But again, the questions people were asking were brilliant, really good questions, and it's good to answer those questions and make sure that you feel confident about your ability to get vaccinated. And so again, if you have any further questions, you can always email us. But certainly talk to your healthcare provider. Make sure you prioritize this because it's really important that we do. And Vivien, do you want to have any last words?
No, I appreciate you doing this seminar because I think it's important for everybody to understand about vaccines. There's so much misinformation in the news and social media. And the bottom line is, as the population is aging, we want to keep you out of hospital. That's what this is all about. Your immune system's aging. We need to vaccinate you because we need to keep you independent and in the community. And that's where you want to be. So thank you, Samir. Thank you for having me share this with you.
Thank you so much, Vivien. And again, it's all about staying healthy, independent, and confident about aging well. That's what we're all here for. And so again, thank you everyone for joining us today, and have a good rest of your day.